All right, so we're here with Jillian, and she's going to tell us about her experience here at the office. So, Jillian, why don't you go ahead and tell us where you were at before you came here and what brought you to the office?
Before I came in, I was struggling for maybe 3 or 4 years with extreme anxiety, some depression, chronic fatigue. Mind you, I'm only 23. I was always tired. I had burning sensations through my lower abs and down my legs, left side of my body. I was being diagnosed with bladder infections that didn't really exist. So I was having pain in my bladder area. I was having chronic yeast infections and bacteria infections that, no doctor was giving me answers about. No medicine was fixing it. So I was just kind of at the end of my ropes when I got here, just looking for some answers.
Right. And what do you feel like since you started care with Dr. Lawrence has changed for you? Like a lot of those things?
Yeah, a lot of them. I changed the way I ate, which completely has changed my health immensely. I lost 17 pounds since I started with her, just changing diet alone without exercise. My anxiety has changed immensely as well. It's almost a complete 180 from what I used to struggle with when I was anxious about almost anything and everything in my everyday life. Now I'm only stressed or anxious about normal things. I handle situations better. My mood's better. I'm happy. I'm joyful. I can enjoy everyday life as opposed to being depressed and worried and just tired. And the fatigue has changed as well. I can just wake up and go to work and feel normal, go to bed at a normal time, have normal energy, feel the way a 23-year-old should feel. My self-confidence has changed because of all that. My self-image has changed because of all that. My outlook on nutrition and health has completely changed. The burning in my hands and my legs has gone away. So a lot of inflammation, a lot of just random chronic pain has disappeared since I've started.
Absolutely, and that's such a wonderful change. And like you said, you are young, so that's something that's like, you don't see that often. So it's definitely a significant change. And we know a lot of people out there suffer with anxiety issues. Big time. That's a big one
And
to know that that's
depression
really
and fatigue,
changed. Yeah, for you that much.
Yeah, it's an immense change for me, which is I'm so thankful for, because struggling with anxiety and depression, you feel like, taking a pill. And I did take anxiety medication for about 6 months. I gained 50 pounds from it. And I've lost that since then, but who wants to have to take a pill every day when you're 23?
Absolutely.
And it's not necessarily doing anything.
Absolutely.
So to naturally be able to enjoy life and feel quote unquote normal is a gift. So
absolutely. And do you feel like for the other people out there like who may consider coming here, that what you changed as far as your diet and lifestyle, it's worth the benefits that you gotten as far as your health and your treatment? That it wasn't so hard. I mean, it's different, but it's not so hard.
Yeah, it's different, and once you get it and you see the results, and then even when you get halfway through treatment or finish your treatment and look back, you just kind of see like, wow, I didn't really know where I was and how stuck I was until here I am, and things are clearer, and you learn about nutrition, and Dr. Lawrence is just so amazing at explaining the mechanics of the body, and our bodies are machines, and just the food that we put into our body is so important, and how it affects almost everything. So my outlook on that has changed, which has just brought me to a great place, and I'll continue to eat in a good, nutritious way to keep my body balanced and healthy for the rest of my life.
Absolutely. Well, Jillian, thank you so much for sharing your story with us, so that we can share with other people, so that maybe they'll get healthy and feel just as you do and have that beautiful smile, so now you can enjoy your life, right?
Absolutely.
Thank you for your time.
Thank you.